Miss Ellen Phipps here. Ellen is the executive director of Aging Together. Hopefully, you all know her, have interacted with her in some way. And in 2024, Ellen and her team led the initiative of making Culpeper a dementia friendly community. And she's here to talk to us a little bit more about that. I'll pass it on to you, Ellen. Thank you for being here.
Great. Thanks so much for having me. We finally got a date. I know we were back and forth a few times, but it's great to be here. And I don't know, I'll just sort of throw this question out there, not that I can necessarily see you all, but how many of you have heard of the Dementia Friendly Initiative? I'm just curious. Has anybody heard of that? Some of you have. Okay, great. Yeah. So basically, Dementia Friendly. Um, it's an initiative that was created, it actually came from England. And then about 25 years ago or so, some folks out in the Midwest brought it over to the States, and then different communities working with either the Alzheimer's Association or some other organizations started to do it over here. And it's really what it is. It's an effort to make communities more welcoming and accessible for people living with dementia. So it's just a way to kind of raise awareness, but make people with dementia feel comfortable going out into their communities and doing all of the things that they always love to do. And, sometimes that can be very challenging for somebody who's living with dementia, and caregivers can get embarrassed. I always tell this story because I just think it really highlights one of the reasons why it's important to do this. And it's a personal experience. My dad, who died some years ago, but the last sort of 5 or 6 years of his life, he had Alzheimer's disease, and he was living in a facility down in San Antonio in Texas. And I would go down to visit, usually a week at a time or whatever. And throughout his dementia, like one of the things that really remained strong with him was that he still loved to go out to eat. Like he always enjoyed going out for a meal. And even with his dementia, he still enjoyed doing that. And I would take him, to a decent, not a fancy restaurant, but a nice restaurant. We would go for a meal, and we'd be sitting there. And I remember this one time I took him out for lunch, and it was a nice restaurant. And he just first he started fidgeting with his mouth a little bit, and the next thing I knew, before I could say or do anything, those dentures were out and they were on the table. Like his dentures were just sitting there on the table, and I was, of course, mortified. And the server comes over, and I'm really mortified. And I eventually I just sort of put a napkin to cover him over. And then he's continuing to eat now without his dentures, and he put something in his mouth and he didn't like the taste of it. So he spits it right out, right there, right on his plate. And so, my dad was a very proper person, and he never in a million years would have done anything like that. But it was because of the dementia that he was, that he had no filter, he had no understanding, his reasoning, it was all gone because of the dementia. And so, in a situation like that, if you had somebody, serving a meal, and they saw something like that in their restaurant, or if he had said something rude to a server or something, people might say, maybe ask them to leave, or, maybe ask them to please don't come back again or something, because they don't understand that the reason he's doing this is because he has this disease process going on and he can't help it. So if they understand why maybe someone's taking a really long time to decide what to order, or if they're putting their dentures on the table, or if they're saying something rude to them, they can understand that it's not personal and the person's not being mean or offensive. It's just that it's part of the disease process. And they can, sort of roll with it and still make them feel comfortable being there. And so that whole idea of raising awareness to the general public and making people feel welcoming in their communities. Um, and so why is this so important? Is because if you look at the numbers in Virginia, there are over 10,000 people living with dementia or cognitive impairment. And this number is going to just continue, it's just going to continue to grow. The prevalence is about 1 in 8 people over the age of 65. And when you jump up to 85, it's about 1 in 3 people with dementia. And these numbers are getting bigger. And so what about, oh gosh, about two years ago or 2.5 years ago, we were approached by a volunteer. Aging Together was approached by a volunteer. Some of you might know John Beck. He was very enthusiastic. He had been involved in this program in Florida. And this is something that Aging Together, I was with the Alzheimer's Association for 18 years before I came to Aging Together almost 6 years ago. And I knew this was a program that I wanted to get going in the Culpeper and in our 5 counties, starting in Culpeper. But we just didn't have the bandwidth to do it. And so this very compassionate and excited volunteer came to us, and he had had experience doing this program in Florida. And we partnered with the chamber, and we sent out letters to all the businesses. Amy signed the letters, and encouraging the businesses to take on this program. And what happened was actually pretty staggering, because if you think this program is available across the country, and it's available throughout Virginia. And Culpeper's response was phenomenal. And a lot of that was because of John Beck's passion, for sure. But also, it took this community to respond with, we now have over 60 businesses and restaurants just in Culpeper that are dementia friendly. And I'll talk about what that means in just a second. But it's really quite staggering. And the gentleman I work with this program at the state level, he was just blown away at the number of people in Culpeper. So, I mean, Culpeper really knocked it out of the park. Some of you might notice when you walk around Culpeper, you might see these little decals in some of the restaurants and businesses that says this establishment is a dementia friendly establishment. And what that means is they've just gone through a 30 to 40 minute training session. It's not a long training session. It doesn't take hours and hours. Anybody can do it. We try to offer these programs either early in the morning before work, because we know people are running businesses, or we can do them in the evening. We can do them by Zoom. We can do them in person. It's just whatever the businesses want to do. And basically what happens is one of our volunteers will either come to your business, or sometimes we offer them up at the library, and the staff can come in and go through the training. And what we do in the training is we just raise awareness, because a lot of people just don't know necessarily, unless they've had personal experience, which of course a lot of people have had as well. But a lot of people just don't know the basics about dementia. There's a lot that's very much misunderstood. So we review sort of 5 key messages that we talk about in the training. And the messages are basically that dementia is not a part of normal aging. It's caused by a disease of the brain. Dementia is way more than just memory problems. A lot of times people say, just assume that it's just memory problems, but Alzheimer's disease and other types of dementia can impact many parts of the brain, not just memory. And so people have trouble with thought processing. They have trouble with speech often. They can have trouble with visual awareness and acuity, and they um, they can have a lot of trouble with not just speech, but also following conversations and communication. So it's really a lot more than just memory when somebody has dementia. And then a lot of times people don't really think about this, but a person can actually have a good quality of life, even if they are living with dementia. And a lot of that just depends on how those people around them respond to them and to the dementia with compassion and understanding and learning some tips and tools for communicating with them. And a lot of times we refer to people, and the fifth message is there's more to the person than the dementia. And a lot of times we say things like, oh, that dementia person or something. And we really try to raise awareness about the language that we use when we're talking about dementia, so that we're talking about a person who's living with dementia, like a person who might be living with diabetes or with cancer. They're not a cancer person or a diabetes person. They're not a dementia person. They're a person who's living with this disease. So that's part of what we do in the awareness. And like I said, the prevalence is huge, and it is growing. And so it is really important to to raise that awareness so that people living with dementia and their caregivers can still engage in the community. They can still go to the shops together. They can still go to restaurants. And if somebody's walking down the street in Culpeper with their parent who might have Alzheimer's disease or something, and they see a decal, in a restaurant that says we are dementia friendly, they might, think, oh, this is great. We can go in here because they understand about dementia. So it's really to help normalize, help people who are living with dementia continue with their, normal lives, and just continue with as much normality as possible, because they've lost so much, so that anything that we can do to keep them living their normal and best life is just really important. I know I've just said a lot. I'm just gonna pause and just see if anybody has any questions or comments. Um, Again, I just want to, before I open it up, I just want to also say that we are available for our volunteers to come out to your business, or sometimes we have programs early in the morning or late in the afternoon at the library or other places. So if anyone's interested in signing up their business to do a dementia friendly session. But I'm just going to pause and see if anybody has any questions.
Ellen, this is Trip Butler, is there like a refresher course? So a lot of that, John was amazing, and he really got out there, and but a lot, some of the businesses probably have employed new folks and things of that
Right.
nature. And so I wondered if there was some site that you can go to have a refresher course. Um,
Well, that's a great question. There's yes and no. I'll say there's not technically something called a refresher course that we offer, but we when we talk about dementia friendly, we're talking about the training to businesses, but we also do something called Dementia Friends, which is basically the same thing, except it's for individuals. And we offer that Dementia Friends session virtually every quarter. So that is a great opportunity. It's free. You can just sign up on the Aging Together website and jump on. That one takes about an hour, just under an hour, and it would serve as a great refresher for anybody, that um that wanted to review the facts. And it does go, that one actually does go a little bit deeper than the 30 or 40-minute session for the businesses. So we would encourage folks to do that.
Is there a Zoom option for that by chance, or a Teams option?
It's
I'm thinking about our organization is based in Charlottesville, and we've taken the training at the branch, but it might be something that our company might want to roll out.
Yes, yeah. It's right now those quarterly sessions are virtual. They are
Okay.
virtual. Yep. And you can find those at the Aging Together website, agingtogether.org. And I don't know how many of you know about Aging Together, but I will just say this is one of the initiatives that we do. But Aging Together's mission is connect people to resources and communities to improve quality of life as we age. And so we are really an organization that is looking at gaps in services in our for older adults in our 5-county region, and then looking at different solutions and different ways to fill those gaps. And that could be with maybe there's transportation issues, or maybe there's housing issues, or food insecurity, social isolation. And these are all the things that we work on through the Aging Together teams. And one thing that was very noticeable is that there was a real, and there is a real lack of support for families who are living with dementia or dealing with dementia or Alzheimer's disease in our region. So the Alzheimer's Association, like the closest office is Charlottesville. The closest program person now is all the way down in Roanoke. They are really focused a lot on research. They have a fantastic website, great information, but there's still families still need a lot to, they have a lot of questions and they need a lot of support. And we get phone calls at Aging Together all the time. And we're able to tell them about local resources like Generation Central, or, the food pantry, or respite programs. Um, so that's a lot of what Aging Together has been involved with.
Ellen, I shared this previously with you. My dad died in August 23 after a battle of early onset Alzheimer's. And right before, the week before he died, Susan from Wild Birds Unlimited had just taken the training. And she said, the training was great. And, we went over it with her staff, and she was discussing it. And then my dad died in a facility in South Carolina, hospital, a well-known hospital in South Carolina. And the whole time, like, the nurses, the doctors, like, couldn't grasp how to communicate with him. I would ask him questions, and we're like, he has Alzheimer's. Like, at that point, it was obviously pretty significant. And we just struggled after struggle after struggle all day Saturday. And I finally said, it would be better if he were in Wild Birds Unlimited right now in Culpeper. And I told Susan that. I'm like, Susan would have provided better care for his last days than a hospital facility. And like, that's what this Dementia Friendly can do to a community. Obviously that was an extreme, but I know taking him out, and waitresses and such in some restaurants would be like, what are you going to have? And a menu is just overwhelming.
Yep.
And it's like just give him 3 options. Like, let's, just give him the options off the kids' menu, and it'll be fine. So I'm really appreciative of all the work that Aging Together has done and John's done here in Culpeper. It's pretty phenomenal. And it's something I like to brag about when we talk about just how welcoming the community is.
Yeah, thank you so much for sharing that. I do know both professionally and personally how challenging that is. When I had similar experience when my dad was in the hospital, and you just cannot believe that people in a trained professionals in a hospital do not know how to communicate with a person who has Alzheimer's. It's just really pretty terrifying. So Yeah, and I think that the response from Culpeper really, really is quite unbelievable because I mean it's I don't know. There might be one other community like in Northern Virginia that's done as much as we've done in Culpeper, but you know, most communities there might be a handful of businesses, maybe 5 or 10, but to have over 60 in this small community, it has been a very positive and incredible response. And Susan's amazing. I know she's has such great stories about how since the training, how they've been able to sort of approach people differently and have some real success.
I've heard quite a few of those great stories coming out of Wildlands Unlimited as well. And I had a question about you said there may be one other community in Northern Virginia that has done as many trainings. Can you tell us more about the recognition Culpeper has gotten from this? I know it's been in a
Oh,
couple stories
yeah,
and articles.
right. I'm trying to remember that, but there was actually like a food magazine. This woman from it was like a Southern food magazine. And this woman interviewed me and she interviewed John and she did this extensive article. And the reason she did it was because um, she was just sort of randomly in Culpeper and she saw all the decals on all the businesses and she was like, and I think she had a parent with dementia and she saw this and she was like, wow, what is this? What's going on here? And she ended up, I think she was a freelance writer and she ended up doing this extensive article and
Oh, hold on, Ellen.
yeah,
It seems like your
did you lose me?
audio cut out.
Oh,
There we go.
There you go. We can hear you. I apologize.
oh, sorry. She's like, stop talking. No. Um,
I was gonna make sure we didn't miss anything.
but
So she
yeah,
was a freelance writer.
yeah, and so I think she had a parent with that was living with Alzheimer's or dementia of some sort, and it was like a Southern magazine, and there was this extensive article about Culpeper. It was really very cool. And we have had there's been a lot of coverage in the media. I can't remember all the different articles, but we've had quite a few. And of course, I will say, I don't want to understate this is that I feel one of the reasons it was so successful as well was because of the partnership with the chamber, because you really need, you know, it's one thing for an organization to just be out there saying we're doing this, but if a business organization like the chamber is backing it, supporting it, um, letting people know about it, and encouraging people to sign up for it, that that is a model that has proven to be really successful. And not every community does that. I mean, communities are asking me, how did you get so many people to do that? And I credit the partnership. So in Orange, we just recently launched in Orange, and we had like 8 different partners, not only the chamber, but a Rotary and excuse me, quite a few other organizations that wanted to partner to support it. So just put that shout out to you, Amy.
Ellen, this is Sam McLaren with the county. I don't know if you can see me on the screen.
Yes,
We've been-
hi. Hi.
We've been communicating the past couple of days through email.
Yes.
But I did want to take the moment to say, I know you won't be around in May for the May board meeting, but I do hope that maybe somebody from Aging Together can be there. You know, not to
Yes.
talk about Dementia Friendly unless you feel like you can or want to at that time, but with that proclamation, it may be good to have someone from the organization there. So.
Caroline Smelts will plan to be there. That's at 10 o'clock, right?
Yes, ma'am. Yes, ma'am.
Okay,
10
yeah,
o'clock.
and Thank you. And thank you for your emails. And, I can't, like I said, I can't be there. I'll be out of town, be at the beach, but,
Hey, that's all
I,
right.
uh,
Okay.
I would be happy to come back anytime and talk to the group about the dementia friendly. If I know we've done that before, but it's probably been a couple of years. So just let me know. We can come anytime.
It has been a couple years. I did participate in the training that we did with John, when that happened, but I think it may be good to have you come back to the board, and ask to do that training again at some point. So,
We would love to do that.